We are excited today to talk about community engaged research, which is a new initiative I think that's kind of taking off not only in the department but also across the university, as you'll hear today, because we've got a bunch of speakers, not only representing the department but also Maternal Child Health Research Institute, as well as the School of Medicine and even the larger campus. I'd like to have the pleasure actually to introduce our speakers today. I'm going to do all the introductions first, and then we're just going to kind of flow into the presentation. For those of you who don't know me, my name is Anisha Patel. I'm in the Division of General Pediatrics as an associate professor, and I have the pleasure of directing a new office of community engaged research that just launched last year with Don May Tan and also Mary Chen, who's back there in the back. We also would like to say that, in addition to working with MCHRI, we're also here to support the department in various capacities as well. In addition, we have Ryan Pedrez, who's here in the audience as well. He is actually also in the Division of General Pediatrics as an associate professor, and he here in his role today will be discussing the Office of Child Health Equity's efforts to really embrace community engagement and also research. He also has another hat as medical director of the primary school, which is really an innovative model for education, bridging education and also health for low-income families here in the Bay Area. Sarah Hopwood is actually on Zoom. You can see her here. She is the director of program education in the Stanford Impact Labs, which is a brand new innovative program. She leads the design and the delivery of the Impact Labs educational programs, working with faculty, postdocs, and students to promote and build capacity for implementing social impact research in partnership with policymakers and practitioners. Her expertise spans policy, research, program design, and implementation. And lastly, we have Catherine Connors, who's here as well. She has worked in clinical research here at Stanford for over 10 years. She brings expertise in public health to the space and actually leads the Research Participant Engagement Program, which aims to engage participants as partners in research via outreach not only at Stanford, but also beyond. She's passionate about increasing awareness of the importance of research participation and leveraging shared expertise to engage diverse patient populations and communities in research. And a fun fact is Mary Leonard, who's here, actually brought some of those practices here to Stanford from CHOP, where she was previously. So with that said, we're going to move on to our presentation. So first, Don May and I have the pleasure of really talking about the Office of Community Engaged Research, which just launched about a year ago in MCHRI. And just to introduce Dong May briefly, she has public health background, but actually worked in the San Francisco Department of Public Health for over how many years? Seven. I got it wrong. 7 years. And she has really on the ground capacity and really has worked with community partners in a lot of low income neighborhoods in San Francisco. So we are really thrilled to have her be a part of the office. And just to understand what the mission of the office is, it's to promote health equity specifically for maternal and child health populations. And we are trying to really help researchers here to really understand how to use community engaged research approaches, but also develop collaborative relationships, not only with community partners and patients, but also policy entities. And so, what is community engaged research? I feel like it's a term that's getting introduced a lot in a lot of spaces. And so, really, what it means is working with patients or community partners or policy entities for that matter, whatever you define as your community, could even be a clinic, to design the research study together. So, you're actually going to go with them and really understand what are their priorities and then work with them to understand what is the best study design. How are you going to gather the data, even the evaluation of the instruments, really working to develop those survey questions together. And most importantly, I think really the evaluation and dissemination piece. So by working with community partners, patients, and policy advocates together, you can really ensure that the translation is occurring more rapidly. So this really is a spectrum community engaged research. So we're going to talk more about like the different spectrum. I'd say today, Catherine Connors will talk about participant engagement in terms of recruitment of participants. But I think our office is really focused on trying to get people to the community-based participatory research if possible at some point, where you are really fully engaging with the partners in the research process. But I would say out of the Spark efforts through the department too, we did hear loud and clear that participants in research really want to hear what happened when they participated in research. So I think that's something else we're kind of looking to help work with researchers to understand how when they conduct a research study, how they might be able to take those findings, not only publish it in PubMed, where people really don't have access. I think with open access, we're getting increasing access to those publications, but a lot of times it's not in um, presented in a way that a lot of patients really could understand. And so, how do we get that information to an infographic or something that our community members could really learn from, or present it back to them in, a presentation, webinar, et cetera? So, why is this even important? So, I think there have been numerous studies that have documented why community based participatory research is actually beneficial. First, it can actually improve the relevance of the research for the patients and the communities when we work with them to identify what are the needs. So, like in clinic, we hear a lot of times after COVID, mental health is a concern. So, that would be something we'd want to address based on, what the community is telling us. It also helps us to tailor the research to the actual local context and the culture. It improves the rigor of the study as well. So, personally, when I've been working with community partners and we design research instruments together, we get questions that are a little bit more easy for the patients to understand, or maybe more culturally relevant examples, because I work in nutrition, for example. So it can actually improve the reliability and validity of those survey questions. Also can help to improve response rate and retention. I was telling the story, we're conducting a child care center study right now, and we've gotten 85% recruitment response rate from parents. And these are parents who are struggling and have a lot of, other challenges. But because we're working with community partners and the child care centers to really help with the recruitment, that has enhanced the retention so much, and also the response rate. Reach is also important using this approach. So, by engaging the community and the policy partners early, you're able to get the research findings out to them more rapidly, and then they can actually take that and run with that in terms of practices and policies. Also, can improve sustainability of the research as well, because when we're designing the research with partners, we're thinking about what is sustainable and what is feasible. So, what is our office doing? I'm going to give you a high level overview, but then May is going to kind of dive into the details. So, first, we really want to support research. And one thing that we're trying to do is really work one on one with individual researchers. So, you can reach out to us to get technical assistance on any grant applications, or even if you're just thinking like, how do I even get started? We want to be there as a resource for you and meet with you. We also are collaborating with other groups on campus to really build a community of folks who are really interested in using this approach. So, as you'll hear from Catherine Connors and Sarah through the Stanford Impact Labs, and Ryan through the Office of Child Health Equity, really working together will help us amplify our impact. We've done a lot of listening sessions and mapping just to really identify over the past year, like what are the gap areas, what are the challenges that research is facing, what are some of the tools that they need, and that's what we're trying to develop in terms of resources. And lastly, with regard to education, as Mary Leonard mentioned, we did have the MCHRI annual symposium that was focused on community engagement research, so that was a top priority. But we're also building that out through other MCHRI educational seminars, and Dame will tell you specifically which ones. And then we're working with our partners to also deliver presentations on community engaged research at other venues as well. Great. So I'm going to pass it on to Dame.
Yeah, thank you, Anisha, for the overview about what is community engaged research and then what our office is doing. And now I'm going to provide like more details on our service and program. As Anisha mentioned, we would like to work with the research and provide the researchers and provide support. So that's why we got a lot of requests from the researchers say, hey, Anisha and Dome, we would like to think about how to develop community engaged research, or I would like to reach out to the community partners. I don't know, like what is the best way to reach out to them, or like the best way to like communicate with the community partners, or even like how can I set up a community advisory board? Like this kind of requests, we got a lot. So, and then that's why, and we work closely with our partners, including school medicine, OC and then like Catherine Connor's office and other like the OC OCHE also together to develop a central TA request form. So you can access the form on our website, or I am going to share also a QR code. You can see like to just submit the TA request from the form, and then we'll take the request. We'll set up a consultation with you. So the consultation is free. So we would like to just like to meet with you to understand the needs, and then we can provide like specific advice on that. So, and our office respond to all the maternal and child health research, like focus on the requests. So, and then here is the QR code. You can just scan and then like to get to the TA request form here. So I also did a like a screenshot and to show you how the TA request form looks like. And then also you can see there are the 5 partners list here, including us, called the MCHRI Office Community Engaged Research. So that is the office we partners together. So like, for example, the Stanford Stanford Medicine OC, they're focused on more the adults part, and then and our MCHI, and then also the OCHE, we are more focused on the maternal and child health research part. So, and then also we just set up our monthly meeting. So we will meet together as the whole team to discuss like each request, and then how we can work together and provide a comprehensive support. So, and then so far, since I joined the team May 2022, so we got about like 17 requests so far. So, and then it's pretty good. So like the one call of the overall request. So, and then some people might ask like what is the technical assistant means and what kind of requests we got. And here I would like to share about 2 examples to give you some ideas. So the first is like one researcher and the team reach out to us. They would like to applying for MCHI grant, and then they would like to use community engaged research approach, but they have no idea how to start and then like how to put together a proposal. And then they send out the request, and then we met with them and we provide advice on proposal development or any other like funding opportunity they can reach out to, and then like some of the tips on doing like reach out to the community partners because like they haven't have a community partners on the project. And also we advise them to set up a community advisory board for the research project. So, and also I want to mention this kind of request is not like only one time, like after we met with them, so later they might reach back to us again to like for some specific questions. So we have kind of this ongoing conversation and like partnership building. So, and another example is actually is very common, and most the requests we got is like how I can recruit diverse participants for our study. So we got a lot of requests on that. So we will like meet with them like the other requests, and then to develop a teaching on enhancing diverse participation in the research. And then most importantly, we would like to connect them with Catherine Connor's the program, because like she has a platform and there's some channel can help the research to recruit diverse participants. And I know Catherine Connor will share more about her program and how she can work with the researcher on that. So I'm not going into more details. So, and then here I would like to emphasize we are not, as a new office, we definitely would like to understand more about what is the existing partners and resources across campus already. And then also through this process, we would like to work closely with the partners. So internally, we work with the different MCHI office, including CRSO, like the Clinical Research Support Office, and then like the Clinical Research Coordinator program as well, D3 grants and other program. And mostly we build a strong partnership with a lot of us, the partners here. I know there's a long list. I'm not going to read through all the partners' name and like that, but I just want you to know, like we have our regular meeting with them, and then also partner together on different projects. So if you're interested in like what kind of service they provide, and then you can click the link and go into it. So actually, we already have some the partners already here, like Ryan's office and Catherine, and then Stanford Impact Lab, and also like others like the Heart Center. Even they cannot be here today, but we work closely with them as well. So, and then, and another focus our office provide that free tools, because through the conversation with the researchers and the partners, they say we need the toolkits and some like template we can use for our research. So, and based on this kind of conversation and the needs assessment, we developed the toolkits, like some toolkits for our research to use. The first one we developed is like the summary language of our office community engaged research. So we inserted into our overall MCHRI template. If you would like to use it on your like a proposal application and like other materials, you can find it on our office website. And then you can see on the right side that is the you can just scan the code and get to our website. So we also like developed a t-shirt on engagement for enhancing diverse participation in research. Why we like put together this kind of t-shirt? Because we got a lot of requests from the research saying that they now a lot of grant they require such a like community engaged component on the proposal, and then they reach out to us say, Anisha and Dongmei, like I have no idea like what kind of language we should put into that, and like what is the best way to really like doing this kind of community engagement. So that's a tissue we would like to share with you. If you are interested, feel free to reach out to us. We would like to share as well. And then we can also set up a meeting to talk more about like specific strategy. And also another very important template, we also got a lot of requests from the researcher is the community partner agreement. When they work with the community partners, they would like to set up a template. And then we, so it's like they want a template they can use, instead they develop something new. So it's in progress. We would like to share once it's published. And then also like Anisha already mentioned, like after I joined since like last year, so I met with like different like partners and researchers, like about like 23 people. So kind of like understand what they are doing, and then what's the some support or needs they would like to get from us like that. So after I gather this data, I put together a resource list. I almost finalized the resource list. So hopefully we can get it distributed by March or April. So, and then another needs assessment I'm doing is with the structural racism grantees at MCHRI. So that because like a lot of researchers who at the apply for the grant, they are using the community engaged research approach. So through the like 30 minutes informational interview, I kind of like understand what they are doing, what the best practice they would like to share, and what's the barriers they face when they're doing community engaged research. So, and then so far I met with 13 of them. So I'm thinking the next step would be like analyze the data and then put together the finding and share back to the stakeholders. So, and then I know a lot of people are also interested in the funding resources. Like, oh, I would like to doing community engaged research, but what would the best funding resource for me to go and take a look at? And here is our team put together for some of the funding resources. Like some of them I already mentioned, we are the close partner with them already. Like the Stanford Impact Lab, Sarah, she is going to talk more about that after. So, and Stanford Cancer Institute and Stanford Medicine Office of Community Engagement and our own MCHRI also have a funding opportunity for that. For example, the one I just mentioned is structural racism grants, the pilot grants. So, and then out of the Stanford, the Pediatrics also have some great funding opportunity for you to look into it as well. So, and then another main focus we are doing is the training. So in the past year, we have several training focused on community engaged research, including the symposium. So here is the several upcoming training I would like to share with you. The first one is on March 16, is coming soon. So it's the community engaged research 101 workshop. That would be a great workshop for the project coordinator or the project manager who kind of like serve between the participants and the PI. So, and then through the workshop, we would like the attendee to get to understand what is community engaged research, some of the basic principle about like doing community engaged research, and then definitely we will like also share some resources and toolkit for the attendees to bring back to the team as well. So, and then I also put the QR code here for the registration. So feel free to share to your team if you are interested. And then also for the upcoming, like the pediatric grant routes, we also have the community engagement and health equity focus topic. And then another things, and we already plan out and schedule 2 community engaged research focus topic for the MCHR MCHI seminar series in September. There are two sections. Section 1 is increasing diverse reputation in maternal and child health studies, and also like Catherine Connor is one of the presenter as well. So, and then the section 2 is principle of community engaged research. So there's the two great community engaged research topic, and then you can check the screen, the QR code on the right, and then for more details later. So, and then here is the like something I would like to share. Now I would like to turn it back to Anisha. Thank you.
Great. Okay. I'm going to wrap up so our other presenters get their time that I promised. So really quickly, you've heard about this from Mary Leonard a lot of times, but the MCHR symposium, we had really great attendance and also a lot of wonderful speakers, and the recordings are available, but there were funding agencies, including NIMHD, as well as PCORI, which Don may mention as a funding source, as an RWJ, and they all have specific initiatives focused on community engaged research and building power and community power in research. Nina Wallerstein is an expert in community-based participatory research. She also presented, and she has been actually engaging Stanford in a PCORI-funded effort to really help us leverage infrastructure here to make community engaged research easier for researchers and also our partners. Cincy Hernandez Cancio is listed here as well. She's an advocate, and she also has experience of herself developing some great tools for researchers. So again, go to the recordings. There's really great presentations and resources shared there. We also were able to highlight community partners at that presentation, which was great as well, to just hear their perspectives on what it's like to engage in research with academic partners here at Stanford. So really quickly to sum up, really, I think our goal in the office is to support you all and to really build and leverage collaborative relationships with other partners across campus and develop tools. And so we'd love to hear from you. If there are things you'd like to see us working on, please put the information in the chat, or you can ask some questions afterwards. But I'm really excited. These are some of the things we have planned. We're thinking of a funder roundtable for researchers engaging in this to kind of help do some matchmaking, especially with the foundation. Really, they have great services available there too. So really quickly, one quick shout out is to the peer scholarship communities, because I do think that's another way, because we do hear from a lot of the interviews that folks are hungry to get together and really not be in silos, right, doing this work, to be able to gather. And so the peer scholarship communities are a great way for new faculty to come together. And they're typically 8 to 10 scholars in a specific area. And the reason I bring it up today is because there is one specifically focused on community engagement and advocacy. It's led by Janine Bruce, as well as Dr. Bonnie Helper-Felsher and Dr. Bruce. And so that's a great opportunity. So if you want to learn more, here's the contact information for the leads of the program, and it's available in the slides. So with that, I'm going to go ahead and move on to Ryan, who's going to talk more about the Office of Child Health Equities efforts. And if you have any questions, reach out to Don May. There's a listserv she's developed with a lot of resources going on.
Okay, great. Wonderful. Thank you, Anisha and Dongmei, for inviting, and I feel honored to represent the office among my colleagues here. And so I drew the straw to present today. No, but I'm Ryan Pedrez. It's nice to see you all. And I think the theme that I want to hopefully have everyone walk away with this is to know that the new Office of Child Health Equity, about a year old now, similar to the Office of Community Engaged Research at MCHRI, we're really working closely together. And so a lot of these efforts to address equity, if you saw that in the mission of the new Office of Community Engaged Research, also has health equity in that mission statement. And so this is a matter of us working together. There's a lot of work to do, and community engagement is a critical piece to that work. So just to orient us to the Office of Child Health Equity, we are focused on different ways we can try to better address health equity across our Department of Pediatrics. And the way we're sort of laying out that work is we have 3 different arms. We have a community engagement arm, an arm that's focused on equity analytics, that's really looking at policy-driven research questions, and then another arm that's focusing on advocacy and policy participation. But the key point to this is that just like our Office of Community Engaged Research and Office of Child Health Equity, our arms within this group need to work really collaboratively together. So in some ways, I don't see the community engaged arm that separately than the policy participation arm, that we're really thinking about this all together. But key to addressing health equity is community engagement, which means, and we define community just like Anisha should, a very, very broad and wide way. That community can be with patients and families, it can be local nonprofit entities, it can be national bodies of different subspecialties, it can be other national advocacy groups. So community can be defined in many different ways, but we really feel that to best address health equity, community engagement is a critical piece to that. So just to show who's sort of a part so far of the Office of Child Health Equity, you can see many familiar faces across the department, led by Doctors Lisa Chamberlain and Janine Bruce, and Adrian Lazaro is helping to coordinate this. And then I'm a part of the community engagement team with Dr. Janine Bruce and our newest faculty member, Shazeen Sulman, who is, we're really thrilled to be providing some leadership here. The other thing, as a newer member to join Stanford's faculty, I just want to sing the praises to Doctors Lisa Chamberlain and Janine Bruce, who have been doing community engaged work for more than 20 years. Rich history of lots of wonderful partnerships and works in the community, starting back with the community PEDS block that was formed, the stat track that was here, and then really some powerful coalitions that have formed through COVID in the last 4 or 5 years. And so amazing work, and we're kind of joining the team to help build out and make this even bigger and better. So to lay out a few of our goals at the Office of Child Health Equity related to community engagement, we're really thinking about it in sort of 3 goals right now, which is how do we help more of our faculty in the department engage with community partners, and whether that could be research or other types of projects that address health equity. We also want to make it easier for partners out in the community to engage with us. And then finally, we really want to try to demonstrate when there's a community engaged partnership, either through a project or a research or another type of activity, that power of collective impact is really, really important to tell that story and to document, to show how we're changing things. So just a few examples of where some of these goals are coming to life right now are, as we try to increase community partnerships, this could be through things like the stat track and connecting some of our residents with community partners. It also could be our work in collaboration with MCHRI and researchers that want to find and collaborate with different community partners. We could be a help to that effort. In terms of facilitating ways the community can better engage with us, these are really some of the coalitions that we're starting to build and lead, including the Impact Coalition, which is a group of many of our federally qualified health centers and community clinics here in San Mateo County. There's another coalition that comes together called the Mid-Peninsula Coalition that's got a number of nonprofits that are serving the area that come together on about a monthly basis. And then as an example of collective impact, maybe some of you saw the article in the Stanford Medicine regarding the food insecurity screening questions that are starting to be rolled out across our EPIC at Lucille Packard Hospital. And then Baraka Floyd and Lindsay Stevens on the informatics team is really starting to think carefully about how we roll those out. And colleagues at the Office of Child Health Equity brought Second Harvest really as hopefully to be an important and growing partner to that work out in the community. And collectively, we can demonstrate how we can better address food insecurity for more of our patients here at the hospital. So where is this work probably going to touch most of you in the next 2 years is we're really at the Office of Child Health Equity planning to work most closely with 8 divisions that sort of raise their hands to participate in pilots with us over the next 2 years, where we'll focus on increasing, different types of projects, potentially more community engaged research that could happen, as well as what we hope to be more policy and advocacy related work as well. So our office is kind of hot off the press determining which of the 8 divisions we're going to be working with. You're going to hear more very soon. Look out for a newsletter. And then most importantly, though, I wanted to double down and emphasize that our office is really working most collaboratively with Anisha and Dongmei at their new Office of Community Engaged Research. And as you saw, Anisha is on the team here of our equity analytics. So we're sharing staff, We're sharing ideas and networks so that we can do this work more powerfully together. I'll stop there and then maybe let the others go and then we can open up for questions. Okay, awesome.
We got a couple questions from, I'll save until the end. But
Okay, I can come back up at the end. Yeah. Oh, on Zoom. There we go.
Hi, everyone. In terms of the slides, who's going to click through for me?
I can.
Or I can share my screen if that's possible. I don't know if that works.
Oh, great. You just tell me when to go, Sarah. And I'll...
Okay, amazing. Thanks so much. Hi, everyone. Sorry I couldn't be there in person. As Anisha said at the start, my name is Sarah. I'm the Director of Programs and Education at Stanford Impact Labs. If you can click the next slide. So Stanford Impact Labs, for those of you that aren't familiar, we're an accelerator that works across all of Stanford. So we work with all schools at Stanford. And really our kind of mission is to accelerate the impact of higher education in addressing social problems by kind of reshaping how research and development is done in the social sciences. And what this looks like is we support through training and education as well as funding, both of which I'll speak a little bit more about in a second, faculty and graduate students to work on what we call impact labs. And really impact labs are just any project that sort of has these three dimensions to it on the slide, so that it seeks to address a social problem, so not just understand it, but to also kind of find a solution to it, to co-create with partners in doing so. And so this really speaks to a lot of what Anisha was also talking about in terms of working with partners to kind of design the question, to design the solution, to understand the social problem, and that it's oriented towards ultimately kind of designing, testing, and scaling a particular solution. And solution we use fairly kind of broadly. This could be a program, this could be a policy, this could be informing advocacy, this could be a new initiative, but sort of something tangible that is intended to address a particular social problem. Next slide, please. And so kind of the way that we are trying to achieve this mission is through a three-pronged approach. So one is innovations in education and training. The other is an R&D engine, so funding and investments into impact labs. And then the third is kind of through transforming the culture of public impact within Stanford. So working broadly to sort of emphasize that this kind of solutions-oriented partnership work is something that is valued and promoted and supported within the higher education system. Next slide, please. And so to talk about each one of these in just briefly in detail, so our investment strategy consists of 3 stages of funding. And so this is competitive funding that faculty along with a partner can apply for. So the stage 1, smaller grants of up to $350,000 over 2 years. And these are really designed for faculty in the fairly early stages of the sort of problem definition. So to work with a partner or multiple partners to understand a social problem better, but with the intention of designing a sort of solution or some kind of initiative that will help to ameliorate the social problem. The second stage of funding is called stage 2, which is up to $800,000 over 3 years. And this is intended for one cycle of R&D. And by R&D, we basically mean testing and evaluating a solution as to whether it works. So this is intended to support faculty that already have a partner that have together designed a solution, have got some kind of new policy or new program, and to run an evaluation on how this works. And this might be also through refining it, through thinking about what is the kind of the intended pathway to scale. And then stage 3, which is our larger funding, is actually the first time that we're doing that this year. So this is much larger, up to $5 million over 5 years. And there's 2 tracks here. So one track is for kind of projects whereby a solution has been identified that works, and it's to really scale it, and actually external organizations can apply directly with just sort of a faculty PI support for this funding. And so this might be sort of a solution that's been developed in partnership with a faculty member, has been found to work, and is now going to be scaled out across kind of broader institutions, broader regions, or track B, which is intended for faculty who have sort of been able to use their research insights to tackle one specific social problem in one specific area, and now want to build out sort of a suite of projects or a kind of a more institutional setting that allows them to use this kind of insight for lots of other social problems. We're currently sort of in the middle of reviewing one round of applications, and our next kind of open cycle or window for applications for all these 3 stages will likely be in September. Next slide, please. And so then turning to the training and the education side, so to kind of accompany the funding, we run a suite of training and education programs that really support faculty as well as graduate students who want to do this kind of work, with some initial seed funding, but also with the sort of work training, the mentorship, and workshops to help them think through how to do this work, and whether that's from co-creating with partners, identifying partners, thinking about scale and pathways to impact, as well as communicating about the research. And so we have a series of fellowships and enable that for kind of different stages of people within the university. So we have a design fellowship, which is a 9-month fellowship for faculty. The applications cycle for this opens in May. So this consists of a cohort of usually about 10 faculty every year. You get 50,000 in seed funding, as well as sort of one-on-one support coaching from still staff and cohort workshops to help you sort of build out a project. Then there's a postdoctoral fellowship, and this is a 2-year program that we co-support with research teams. So postdocs are embedded and hosted within a research team on campus already. This is a team that we've specifically identified as sort of being kind of solutions oriented, being about partnership and co-creation work. And so the postdoc is embedded within that team, but then also does some workshops with us as part of a larger cohort of postdocs across the university, all working within impact labs. We have a PhD fellowship. This is just a summer fellowship for PhDs already at Stanford. This includes 4,000 of kind of funding to support the PhD over the summer to work embedded within with a faculty on a project, as well as doing the workshops and the curriculum with Stanford Impact Labs. And then finally, kind of hosted and embedded and housed within Stanford Impact Labs, but slightly separate, is we launched a new major this year, which is a major in data science and social systems, and is really intended for kind of undergrads who are interested at this intersection between social sciences and core kind of social science training, but also applied data science for the purposes of being able to kind of tackle social problems later on in careers. Next slide, please. And then our final pillar, culture of public impact with higher education. So we have a program called Scholars in Service, and this supports faculty through funding to take time out of the university and actually embed themselves within an organization, whether that's an NGO or a policy or government institution. And the idea here is to really create sort of immersive, mutually beneficial learning experiences for faculty to be able to work full time supporting the host organization with this research skills and expertise that they bring, as well as learning from the organization about the environment, the decision-making context, and the role of evidence plays in that particular context. We are also kind of part of a scheme to launch 15 public impact professorships, and these will be across three schools. I think we've had 2 that have been kind of currently being appointed, and there's raising funds for billets for another 13. And then finally, we have Equity Forward, which is a program that was working with Silicon Valley Community Foundation, and we've convened a consortium of higher education institutions in the area to together kind of design and develop solutions to the racial wealth gap through working between higher education and community partnerships across the region. Next slide, please. And so to just kind of give a little bit of a flavor as some faculty, School of Medicine faculty, as well as graduate students that have been involved in Stanford Impact Labs. So Professor Yuan Wang, who's a professor of emergency medicine and pediatrics, was a fellow on one of our cohorts of the design fellowship. So Yuan worked with actually Professor Ryan Matlow as a team to design and find partners for intervention to address kind of trauma-based care and legal holistic approaches for asylum children. Susan did a Scholars in Service leave with the Louisiana Department of Public Health. Anisha, who you all know, don't need much introduction, did a Scholars in Service leave, and is also a host for a current postdoc, Andrea, who is one of our still postdocs this year, and is also within the working within Anisha's lab. Next slide, please. And then finally, I just wanted to briefly mention this initiative that we are also pursuing. Kind of as we've been supporting faculty to do this work, we've realized that the funding is a component, that the training and the technical education is a component, but there's also institutional barriers within Stanford that can make some of this work quite difficult. And so we've been sort of engaging in an initiative to try and understand and start to create movement to address some of these institutional barriers. And so my colleague Amy has been really spearheading this. And it's been a process of initially just spending a lot of time understanding faculty who are trying to do this work and what are some of the barriers they face, and whether this is around like legal agreements, whether this is around hiring, whether this is around kind of the grants administration process within Stanford, and that makes it challenging to work with partners. And we're now sort of like working with university leadership to try and start to kind of make some progress on this to really create the enabling environment to do this kind of work. Great.
Thank you so much, Sarah. Thank you so much, Sarah. If you could just hang on till the end, and we're going to have Catherine come on up. We have limited time, but.
All right. Really glad to be here. I'm going to go quite fast, and the slides will be available. My name's Catherine Connors. Thank you, Anisha and Dungmei, for including our program. We're definitely tend to be on the left side of that spectrum, but I really like to use the word participant engagement versus recruitment. We have a little motto of trying to engage participants as partners in research, and feel that participant engagement, it really is a kind of a two-way partnership. So we're regularly providing consultations with study teams. I'll be focusing quickly on our PEP, Participant Engagement Platform, Honest Broker study invitations. So Honest Broker means that we're sending the invitations on behalf of the study team. Only when those potential participants express interest in the study do they get connected with the study team for follow-up. Very nice for patient privacy, and we can scale. So this includes direct email, and I'm glad you mentioned about Mary Leonard's influence there, because we really, when I came to this role, we're picking the brain of Chris Gantz, who she hired at CHOP, and really set the precedent with using direct email in this Honest Broker process. And thanks to working with C. Joe Thomas's team, we have Children's Epic MyChart. We've had that available since 2020, early 2020, right before the pandemic. We have postal mail that was heavily used because we didn't have Epic My Health, the SHC version of that secure portal, available till last fall. So beyond Stanford outreach, we have social media resources and our Stanford Research Registry, which is a REDCap database of over 10,000 folks who have said, yes, please contact me about Stanford research that may be relevant. Community engagement guidance. We love to refer folks for maternal and child health needs to Anisha and Dungmei, and on the adult side as well. And I'll mention the Community Advisory Board, the CAB, for clinical research. And we have guidance about other resources, including the CTSA Trial Innovation Network, which is a nice resource for multi-site studies. And then two additional services or features that we have, again, thanks to CJO, best practice alerts for research. And the description is there, so in the interest of time, I'll keep going. But this is not an Honest Broker invitation, but rather using the provider with the patient there in real time to invite a potential participant to research. Bulk MyChart study invitations, similar to what we do, but rather than coming from us, the research participant engagement team, it's coming from the clinic. So for example, sincerely, Dr. So-and-so and your pediatric diabetes care team. So to leverage a treating relationship when it's there. That's a big discussion we have about if there's a treating relationship there to leverage, we want you to do that. If you're trying to reach a patient population that's not within your clinic, Honest Broker can be a great resource for that. So this requires documented clinic leadership endorsement, and this may include PCHA Tri-Valley patients. So on that note, our Honest Broker, our PEP invitations, currently is restricted to SHC and LPCH patients. We're really close to including Tri-Valley, and eventually our goal is to include Stanford Medicine Partners and PCHA. Quick note about this. Through our platform, we're tracking age, race, and sex metrics. We also have a gender question in our registry, so we can modify outreach going forward to increase underrepresented populations. And so this kind of connects with, you may have heard about the We Ask Because We Care campaigns happening in both hospitals at Stanford. And this is going to help improve that data in EPIC. Our data is only as good as what's in EPIC. So first one being race, ethnicity, preferred language. sexual orientation and gender identity is next, and then disability status and accommodation needs. We're really excited about that campaign. This is kind of a summary. So that top chunk is really working within Stanford patients, the STAR database that pulls from the epics on a daily basis. Those are our honest broker services. And then we also have resources beyond Stanford, social media and or online information, online directory, and our research registry. And I have this little note here that STAR includes Stanford Medicine Partners, PCHA, Tri-Valley. We are restricted at this time, but as I mentioned, Tri-Valley is really soon, which I'm very excited about. That's going to increase our diversity pool. So we relaunched the Stanford Research Registry at the beginning of COVID, kind of in answering this call for identifying patients who wanted to participate in COVID research. We have the Spanish translation of the whole registry is going to be available very soon, thanks to a new team member who's bilingual. And so this is focused on largely, I'd say mostly Bay Area, but beyond Stanford is the main focus there. Oh, the format's a little funny, but should be all right. We have this directory that we launched, basically had an opportunity with COVID to do this no-cost study directory focused on COVID with a partner vendor, Study Pages. So we now have this parallel directory, but what it's put a little healthy competition on our own stanford.clinicaltrials.edu directory to make it a little more user-friendly. So some of the things we love are this landing page, a little more colorful, all lay language taken from the consent form description, easy contact, easy sign up, and you can have a pre-screener, 3 to 5 questions. And then you can embed this landing page with your social media campaign. So and you can do that for free, like post it next door, Craigslist, Facebook forums, or do paid ads to get your study page out there and have a simple sign up experience. On the back end, how am I doing on time? Oh, it's 1 o'clock. Really nice participant management, including HIPAA compliant text messaging, which has been really well received by study patients and study teams for retention. Community Advisory Board, you access that through that same request technical assistance link. We have our data here. And on our website, we have a cost recovery model in place now. And so you can access the information there. And that's me. This is me and CJO at the MCHRI symposium with our poster. Thank you.
Online can hear them. Okay, first questions from Jacqueline. Any thoughts on doing a more centralized health fee control recruitment effort? This sort of came in towards the.
Actually, yes.
So I would be happy to meet with whoever asked the question, but we definitely do consultations for healthy control. So our research registry is a great resource for that. So it depends if they're looking at Stanford patients versus beyond Stanford, but would be happy to discuss resources for that.
Okay, great. I'll send these questions out with the names of who sent them to the presenters as well. Do you got time for one more question? This one may be a little bit longer of an answer, but let's see what we can do here. Thanks for sharing all this good work and resources. I'm curious, is there any coordinated work across Stanford Medicine to identify community leaders and building out some cadre of advisory group of sorts who could be our voices or sounding board for the community of patients we serve? I'm thinking religious leaders, community center or social center leaders, social activists, similar to our family advocacy council members who are paid employees of the hospital in their roles. I feel like these strategic partners, without these strategic partners, research and involvement in the community won't be as strong. Any thoughts about that?
Do you want me to take it? Or do you want to take it? We could all take it, actually. We all have a response. So I could mention really quickly for the Office of Child Health Equity that is definitely a priority and something we're looking into. I think that would specifically focus on our department, obviously, in pediatrics. As Catherine Connors mentioned, there is also the Stanford School of Medicine Community Advisory Board, which also does have some representation there. I know there's work being done to increase the types of individuals on that board. And if you have questions about that, Lisa Goldman Rosas, who is the director of the Stanford School of Medicine Office of Community Engagement, would be the right contact. And then I don't know, actually, Sarah, is there anything Stanford Impact Labs is working on related to that?
Yeah, so we have actually been doing a lot of work recently to think about governance structures. We already make sure that for all our rounds of investment and funding that we have external reviewers on the board coming from the practitioner lens to make sure that kind of like, you know, the approach and where we put our funding is not just decided by us within Stanford, but we are also thinking about how we build out like a kind of a more overarching governance board, which is not just a faculty governance board and is also an external governance board. And so this is a work in progress that hopefully we will be able to like kind of start and launch really soon.
I'll send those out again if y'all want to elaborate. Okay, that was awesome. Thank you, everybody. Packed more in than we had time for, but that just meant there's lots of good material. So thank you, everybody.